The Omicron coronavirus variant detected in southern Africa could be the most likely candidate to displace the highly contagious Delta variant. That's according to Adrian Purin, the acting executive director of South Africa's National Institute of Communicable Diseases, or NICD. He spoke to Reuters on Tuesday.
We thought, well, what will outcompete Delta? I think that's always been the question. What will outcompete Delta, in terms of transmissibility, at least?
The discovery of Omicron has caused global alarm, with countries limiting travel from southern Africa for fear it could spread quickly, even in vaccinated populations, and the World Health Organization saying it carries a high risk of infection. If Omicron proves to be more transmissible than the Delta variant, it could lead to a sharp spike in infections that could put pressure on hospitals. Purin said scientists should know within 4 weeks to what extent Omicron can evade the immunity generated by vaccines or prior infection, and whether it leads to worse clinical symptoms than other variants. Anecdotal accounts by doctors who have treated South African COVID-19 patients say Omicron appears to be producing mild symptoms, including a dry cough, fever, and night sweats, but experts have cautioned against drawing firm conclusions. Purin said it was too early to say whether Omicron was displacing Delta in South Africa. Anne von Gottberg, a clinical microbiologist at the NICD, said it looked like infections were rising throughout the country, but cautioned against linking that with Omicron just yet.
In fact, and some of those admissions might have started before we think the emergence of Omicron, and we also seen that there was an increase in influenza cases in South Africa just in the last month or so. And so we need to really be careful to look at the other respiratory infections and other respiratory diseases.
We are deeply disappointed.
Leaders in South Africa have criticized swift travel restrictions by the United States and other nations as unfair and crippling to their tourism and other sectors. South Africa has reported close to 3 million COVID-19 infections during the pandemic and over 89,000 deaths, the most on the African continent.